Why is ILC breast cancer often missed on mammograms? Imagine trying to spot something subtle in a busy crowd. That's similar to how invasive lobular carcinoma, or ILC, can hide on a mammogram. Unlike other breast cancers, ILC grows in a very different way, which makes it harder to see with standard imaging. Most breast cancers form a lump or a mass that stands out clearly on a mammogram. But ILC tends to spread out in a single full pattern of cells that infiltrate the breast tissue without forming a distinct lump. It doesn't cause the usual dense areas or calcifications that mammograms are good at detecting. Instead, it quietly spreads through the tissue, blending in with normal breast structures. This subtle growth pattern is one reason why ILC often goes unnoticed. Another key factor is that ILC rarely produces microcalcifications. These tiny calcium deposits show up as bright spots on mammograms and often signal the presence of cancer. Since ILC doesn't usually cause these calcifications, mammograms lose an important visual clue that could help identify the cancer early. On imaging, ILC may appear as areas of architectural distortion or slight asymmetry rather than a clear mass. These changes can be very subtle and easily mistaken for normal tissue, especially in women with dense breasts. Dense breast tissue makes it even more challenging to distinguish ILC from healthy tissue, which lowers the sensitivity of mammography. Research shows that mammogram sensitivity for detecting ILC can range from about 50% to 79%. That means in some cases, the cancer can be missed. In contrast, magnetic resonance imaging, or MRI, can detect over 90% of ILC cases because it looks at tissue vascularity and other features beyond just density. Contrast-enhanced mammography is also more sensitive for detecting ILC because it highlights blood flow and tissue differences. Because of these detection challenges, women who have risk factors or symptoms suggestive of ILC often need additional imaging tests. MRI or contrast-enhanced mammography can help find cancers that mammograms might miss. These advanced scans are especially useful because ILC can be multifocal, meaning it can occur in multiple areas within the breast or even affect both breasts. Understanding the limitations of mammography is vital for doctors and patients alike. It helps ensure that no cancer is overlooked and that treatment can begin as early as possible. In summary, ILC's growth pattern, lack of calcifications, and subtle appearance on mammograms make it easy to miss. Using more sensitive imaging techniques can improve detection and help women get the care they need. Always consult with healthcare professionals for personalized advice and screening options tailored to your individual risk factors.